So good morning, everyone. Thank you.
Good morning.
Yes, good morning. Thank you for being here with us on this special day. It is indeed a monumental moment. Friend Health Back of the Yards represents our renewed commitment to the Back of the Yards community. We have been here for some time in a 5,000 square foot facility. This facility represents triple the footprint, 15,000 square feet. 21 exam rooms, comprehensive medical, behavioral health, soon to be dental, and pharmacy and laboratory services. Friend Health is committed to serving the community, and we are here to ensure that everyone receives access to high quality, affordable, accessible health care, irrespective of their financial ability to pay, irrespective of their insurance status. So I just have a few quick thank yous. First and foremost, I'd like to thank the Back of the Yards community. It is their commitment, their leadership, their advocacy that brings us here today. They fought for this, we worked with them, and we are proud to serve them. My deepest appreciation to Mayor Brandon Johnson, his commitment to health equity, and for being here to celebrate with us today. Thank you, Alderwoman Taylor, for always championing a community-centered development approach, and for always ensuring that the voices of the community lead the process. Gratitude to Commissioner Sierra Boatwright and the Department of Planning and Development for their partnership and support. Thank you to State Senator Maddie Hunter and State Representative Sonia Harper, who are with us in spirit today. And thank you to the United Yards team that brought this vision to reality. Rafael Hernandez and Jose Duarte of the Blackwood Group, Aaron Weisner and Scott Henry of the Celadon Partners, Jesse Iniguez of the Back of the Yards work team, and here we go, and Gabrielle Jakovic, yes, of Design Bridge. And so last but certainly not least, I must thank my Friend Health family, my board, my leadership team, my team members. Your unwavering commitment and dedication to our patients and the communities we serve every day inspire me daily. And to my family, I thank you. I thank you for your patience, your support, and your willingness to follow me off the cliff. So with that, I would love to introduce Alderwoman Taylor, Alderwoman Jeanette Taylor, and bring her to the stage. Thank you.
Good morning, how y'all doing? So I'm gonna start by saying welcome to Back of the Yards, one of the wonderful communities that I get to represent. And so this is the second Friends Health that I've gotten to open up in the last 4 years. Like we have one on 63rd and Cottage. And so think about this. Before I was Alderwoman Taylor, I was just like the constituents that I represent, a poor working woman who struggled. I literally was. And so I had a medical card. And so I never ride past this because I want people to understand. And Friends Health was actually the clinic that I used. It was at the time located on 53rd and Cottage. And I was well taken care of whether I had paid insurance or a medical card. And so I didn't leave. And so I still use Friends Health as my provider because I appreciate the people who actually work here, them working with me, but also thinking about what they bring to the community. And so this project actually happened during COVID, y'all. And so people were actually doing work during COVID. I know you get a little surprised, but we were. And so I'm just grateful that the back of the yard community does not have to travel for quality health care. Now, there was a clinic on 48th and Ashland, which was literally up the street, and I know because I go to the clinic. But I'm glad that they moved to a bigger space so that we can get all our services in one room. Too often we talk about what the community needs instead of asking the community what it wants. They wanted a clinic that is right in walking distance of their home, right in a bus ride, or walk around the corner and up the street. And so this clinic is important. And to the men and women who work at Friends Health, thank you for your service. Thank you for the things that you do in our community, and keep on keeping that spirit of we can take care of you no matter what we make. And that too often we know don't happen. We got a couple of hospitals in the community that people can't afford to go to. And so it's nice to have a space where they have a sliding scale. You can pay what you can, and if you can't, they still take care of you. And we know that don't happen in today. And so I'm grateful to be here today. It's a little chilly outside, but that does not stop us from wrapping our arms around each other and taking care of each other. Remember, it's the holiday season. And while what we got going on in this country don't seem real friendly, don't seem like they love us, we're going to have to love on each other. And so I have the pleasure of introducing somebody that I get to work with, fight with, cuss at, plug up, tug on, but I also get to do amazing things like this and bring great ideas together. And so I'm going to introduce y'all somebody I knew before we were elected officials. We were actually in Springfield and in City Hall getting kicked out and fired. And so I want to introduce to you all Mayor Brandon Johnson.
Wow. Good morning, everyone. Thank you, Alderwoman Taylor, for that introduction and for your leadership. What an incredible opportunity that we have to celebrate transformation and growth on the southwest side of the greatest freaking city in the world, the city of Chicago. I do want to thank the Friend Health CEO, Wendy Thompson, of course, our board chairman emeritus, Mr. Sean Harden. That's right. Yep. The entire clinical leadership team, and of course the frontline staff who touch the lives of the residents and families every single day. You know, as frustrating as life can be at times, I'm grateful that we have Alderwoman Jeanette Taylor because she led a community-driven development process that prioritized the needs of our back of the yards residents. It's that type of leadership that's so critical in this moment to build safe and affordable and more accessible communities. I'm grateful that we have Commissioner Sierra Boatwright and the Department of Planning and Development who made the New City United Yards development a reality. Now, through all of these challenges, I just want you all to know, Alderwoman Taylor cusses, I don't, okay? And she's pretty good at it, by the way. If I were to cuss, I would want to cuss like Jeanette Taylor. But, you know, I am proud that, you know, we all came together to help open up a state-of-the-art 15,000 square foot community health center, representing one of the largest expansions in Friend Health's history of 30 years. And so, you know, it's not just about constructing a new building. This is about a space that honors back of the yard's history while building towards our healthier and more equitable future. We transformed this historic Oppenheimer Goldblatt department store building into, you know, what will be a powerful anchor, an anchor for further neighborhood development and the revitalization of back of the yards and the new city corridor as a whole. My administration believes strongly that access to quality, affordable, and culturally affirming care should not depend on your zip code, because I believe that healthcare is a human right. This center honors that belief and triples the footprint of the previous site, bringing expanded access to primary care, women's health care, behavioral health care, pediatrics, pharmacy services, and lab work all under one roof. With the dental care services planned for 2026, Friend Health is already continuing to show the growth based upon the needs of the community. And for a community that has long advocated for expanded healthcare services, this center is what healthy and quality healthcare looks like in real practice. With coordinated and accessible care, families and residents can get healthy, they can stay healthy, and they are enabled to thrive in our great city. This facility represents what the city is committed to building everywhere: trauma-informed care, behavioral health care, maternal and pediatric services, and community programs like insurance enrollment support, social services, being able to navigate all the different social services that are available, food distribution, and even workforce development opportunities. This center will serve as a training ground for community health workers and expand career pathways for residents. So it's also a hub where jobs and careers can be realized. I'm committed, to ensure that mental health expansion and that framework continues to take place in our city. And our ongoing efforts to continue to invest in healthcare and especially mental health care across our city. In my proposed 2026 budget, and I'll close with this, we moved the city's crisis assistance response and engagement program, or what we call CARE. We moved that program from ARPA funding to corporate funding to sustain this program, which provides the behavioral health crisis with compassion, behavioral health services, instead of further traumatizing our harm. So in other words, as we move it to a more stable, regular fund, it doesn't matter who's mayor, mental and behavioral health care services will always be in the city of Chicago. And so we are aligned with the Friend Health mission to meet people where they are with dignity, compassion, and practical support. Together, I look forward to building stronger and healthier and more resilient communities across Chicago, and of course, especially on the south and west sides. And we need more healthcare access, and that's something that I'm grateful that there's a commitment to actually do that. So today has been made possible because community members demanded it. Back of the Yards residents organized, advocated, and insisted on quality, accessible, and comprehensive health care because they deserve it. I look forward to furthering developing our South and West Side communities in partnership with residents and families to ensure that we continue to honor their lived experience and their vision. Together across Chicago, we will build and expand services that allow families to thrive in safe and affordable communities where healthcare, mental health care, affordable housing, and economic opportunity is not by chance, but it is a reality. So again, I want to thank Friend Health and the community leaders and members who have made this day possible. Congratulations to everyone, and let's continue to make sure that healthcare not only lives in the back of the yards, but it lives across the city. God bless you all, and God bless our amazing city, the city of Chicago. Thank you.
And now, it is my honor to bring to you Sean Harton, our board chair emeritus. What some of you may know, but not everyone, is that Sean Harton has served on our board for 16 years. And he has served and led us as our board chair. We're so grateful for his dedication, attention to detail, and always repping for us. And it's a little bittersweet, but he's not going too far. And so this is a project that we spent many hours talking about, visioning about, planning about. And so I'm very grateful for you, and I want to bring you to the stage.
You are not going to make me tear up. 16 years. Well, she didn't say that I was 14 when I joined the board. Child prodigy there. But when I joined the board, our mission was clear, and it was to ensure that every individual on Chicago's South and West Side had access to high quality, affordable, culturally responsible, and respectful care regardless of their circumstances. And today in this facility and the other facilities that we have represent that mission, and in fact, it's been taken to new heights. So as board members, we're very, very proud to see what has happened and what is still yet to occur. This 15,000 square foot facility is an example of what happens when collaborative leadership, community partnership, and patient-centered design come together. It's clear what can be accomplished. This building stands as a living reminder that healthcare is a right and not a privilege. And this will serve as a lifeline for thousands of families for generations to come. And as already been stated, the residents demanded this. They were actively engaged in making sure that they had access to high-quality health care. And so today's celebration is just not of a building, but of a community that saw what it deserved and refused to settle for anything less. So I also want to recognize Wendy Thompson, her incredible leadership. It takes a lot to take something from concept and bring it all the way to fruition with lots of challenges. So to be able to maintain that vision and bring us along with it, you deserve a round of applause for that. The commitment to whole person trauma-informed care brings the values of Friend Health to life in ways that go far beyond a single site. And as I now serve in the role of Chairman Emeritus, it has been one of the greatest careers of my life, or opportunities of my life, to serve on this board. Healthcare and education are the cornerstones of any strong community. And so it's been a privilege to watch Friend Health grow from a small network of neighborhood clinics to a leading community-anchored system that now serves more than 40,000 patients annually. So today represents a story of expanding opportunity, expanding access, a story of building healthier, stronger communities. And although my former role has transitioned, you guys can't get rid of me. My commitment to Friend Health and to the communities we serve remains unwavering. I'm confident that our next generation of leaders will continue to push for innovation, expansion, and equity. And I'm not going to be far away from your continued ribbon cuttings. I hope I'll continue to get invited to be a part of those. Those of you who play a role in it, I know many of you personally. I'm incredibly proud to have served as your chairman. You guys make it easy. I talk about you a lot. I show off, and it becomes a great thing to do. And this building stands as a symbol of what happens when we lead with purpose, compassion, and a belief that every family deserves to be healthy and supported. It's been a privilege of a lifetime to serve in this capacity and contribute to this work. And I'm proud to see this new health center open as part of the legacy that we built together, and I got through that without crying. All right. Perfect. Thank you.
So that's it. Thank you guys thank you everyone for being with us this morning. I recognize it is the weekend before the Thanksgiving holiday. I hope that you all have a wonderful holiday with those that you love. At this time, we are pleased to distribute turkeys to the community, and so those of you who would like to partake, please line up near our dental section, and we will also begin tours. Thank you again.